This is Talk to KEDI, sharing knowledge, liberating minds. Hello there. Thank you so much for joining me on another exciting edition of your number one educational online broadcast, Talk to KEDI. Our topic of today is benign prostatic hyperplasia, popularly called BPH. In other words, we'll be discussing what benign prostatic hyperplasia is, the common causes, symptoms, people who are susceptible to this ailment, the common symptoms around it, how to prevent, as well as the effective treatment of benign prostatic hyperplasia. My name is Felix Adedoyin. Stay tuned and get ready to learn. To do justice to today's topic is one of our master lecturer. He is the owner of Service Center 1013 located in Lagos. He's also a highly knowledgeable TCM consultant. He's no other person than our amiable Mr. ISREAL Odemuywiwa. With a clapping ovation, let's take welcome to Mr. ISREAL Odemuywiwa. Welcome to time. This is Talk to KEDI, your number one educational online broadcast, brought to you from the stable of KEDI Healthcare Industries Nigeria Limited. We are the leading provider of quality healthcare products and equipment nationwide. Welcome on board and stay tuned. Today, we are diving into a very important yet common health concern that affects men as they age, which is benign prostatic hyperplasia, popularly called BPH. According to experts, about 50% of men aged 50 and above are often affected with benign prostatic hyperplasia, and this figure increased to 80% of men of 80% of men aged 80 and above. Also, the research told us and gave us that 30 million. Share the link with everyone that you know. Let them know about this program, that this is the right time for us to start studying. Invite them. Share the link everywhere to all your friends, family, and loved ones, your prospects, everyone that you know. Share the link to them now. Let us come together as we learn about benign prostatic hyperplasia. So now, sir, over to Mr. ISREAL Odemuywiwa. Are you ready, sir?
Very ready.
All right, sir. Okay. So, sir, I would like to ask you, what exactly is benign prostatic hyperplasia, and how does this ailment affect men?
All right, thank you very much. Benign prostatic hyperplasia is a condition in which the prostate gland grow bigger than its normal size. But this growth is not cancerous. It's never cancerous. It's located at the base of the bladder, and it surrounds the urethra. And it's at the neck of the bladder. Now, the prostate actually grows twice in lifetime. It has two phases growth. Number one, double in size. It double in size at early puberty stage. And after the age of 25, the prostate also begin to grow. That is the second phase of the growth of the prostate. Now, from the age of 25 upward, the prostate grow in size, and the later end of it is when we have occasion where we have something like benign prostatic hyperplasia. Yeah, so that is when we have that. Then when we talk about this, there are other names that benign prostatic hyperplasia also called. It is also generally known to a layman as prostate enlargement. Prostate enlargement, and it's also known as benign prostatic hypertrophy. It's also called benign prostatic obstruction. All these are still referred to as benign prostatic hyperplasia. Yes, thank you.
All right, sir. So with this, we have all learned out what it is and how it affects men of all age. So, sir, what are the common symptoms of benign prostatic hyperplasia, and at what time or at what stage would you say it is necessary for anyone suffering from this ailment to seek medical attention?
Thank you very much. Some of the symptoms that the person that is having benign prostatic hyperplasia will be having is that the person will be having urine retention. So when the person finishes urinating, it will be as if the urine is still
right inside the bladder.
Yeah. The person will also be having frequent urination. Frequent urination. The person will also be having what we call dripping. Dripping. That is when somebody finishes urinating and the urine is still dropping unknowingly. Now, the person will also be having what we call painful urination. Yeah. And the person will also have a weak bladder. Then, some of the symptoms also is that the person will be having frequent urination in the night. The person will be waking up to go and urinate
time to time.
Time to time.
So the bladder cannot retain
and that
the
is
urine.
what we call nonotasia. Thereabout. Now, the frequent urination in the night, the person will be thinking that probably is diabetes. Because it could be the same symptom.
Similar symptoms.
Similar symptom with diabetes. Okay. But if the person did not actually go for medical checkup, the person will not know that he's suffering from BPH. Yeah. So he won't know because he will be having frequent urination. And the person will be having urgency in urinating. That's another symptom. Urgency urinating. If the person delay to go and urinate, the person can start weighing
on the body.
These are some of the serious symptoms that this benign prostatic hyperplasia has.
So, at what time in particular do you think the person now needs to seek medical attention? Is there a particular stage?
When it gets to the person having pain during urination, or is already having urine retention. Because when the person starts having urine retention, the lower abdomen will begin to pain the person. The person will be having pain in the lower abdomen. The person will be having a lot of discomfort in the lower abdomen. At this point, the urine will be having a weaker stream. You know, naturally, as a young boy, a young man, when you want to urinate, you can use your urinate to target an insect. When you raise something up like that, you use it to target it and bring the insect down.
Because it can flow.
The stream can go far. But when somebody is suffering from prostate enlargement or benign prostatic hyperplasia, now the urine stream will be very weak.
It cannot go far. Maybe just go a short distance.
It will be doing tweet like a pipe that the water want to finish. If you do it tweet like that, so and as he's doing like that, the urine will not come out. There will be
retention right inside the bladder.
And this with time will begin to pain the person, and with time, the something will begin to go back to the kidney. It will begin to affect the kidney. So eventually, we are talking about prostate enlargement here now. It will now begin to affect the kidney. So at this point, when there is retention, the person has to go for medical advice immediately so that it will not affect the kidney.
Thank you, sir. Thank you so much. Wow, indeed, this is a very serious issue. Considering the age range of men that are involved. Like what we talk about in our research of what was done in the southwestern Nigeria, that's about 40% of men ranging 40 years and above are already experiencing BPH. So this is indeed a very great concern. So, sir, in your clinical experience, what are the major risk factors for developing BPH, and how can it be prevented? What do you know? Taking Lagos or Nigeria as a case study, what are the major risk factors? What could cause this benign prostatic hyperplasia, and how can it be prevented?
Thank you very much. Yeah, number one risk factor is age.
Yes.
Is age. Generally, benign prostatic hyperplasia doesn't happen to men below 40. And it's not a disease that is actually affect women. It's basically a men disease, men issue. Yeah. From the age 40 and above, research made us to understand that about, I think, 20 to 30% of men above 40 to 64, they have this risk immediately they get to that age. Now, but when the age move from 64 and above, the percentage increase with age. Yes. And according to World Health Organization as well, 1 out of every 3 men will come down with BPH. One out of every 3 men.
Case study.
Yes, we come out with that particular disease. Now, age is number one. Age is number one. If you are still 10, you are 20, yourself. You are 30, I don't think that should come except on its rare cases. But 40 and above, you have to start watching. The number 2 is family history.
Yes.
Because you cannot be separated from your gene.
It's not possible.
Yeah.
It is
the person that gave back to you, the gene is in your body. Risk factor is when someone doesn't do exercise at all. Doesn't do exercise.
They don't fancy it.
Yeah.
Even the common 30 minutes walk that was prescribed by the World Health Organization for people don't do it.
No exercise at all. From here to that place, you are inside the car, you are inside the AC, you cannot even trek, you can't jog, you can't. So, not doing exercise is a risk factor. Then our diet. When you have a bad diet, as a man, you are still taking dairy food, processed food, meat. These are risk factors. And finally, on that, medical history. There's someone that have the medical history of diabetes, high blood pressure, and the rest. All these are risk factors.
Thank you, sister. So, with that, how can they now be prevented? Because having said all this now, how can it be prevented?
All right. Benign prostatic hyperplasia can be prevented by actually doing the opposite of some of these things we have mentioned.
Okay.
Number 1, you avoid alcohol. You avoid alcohol.
So for someone that is obese,
you avoid alcohol
and everything.
Yes.
Okay.
Then you abstain from all this dairy food. That is like milk and the rest. So you abstain from it.
So I want you to explain further. When you ask us to abstain from dairy products and co, is it starting from that age range?
Yes.
That age 40.
Starting from that age range, you have to limit it. If at all you are going to take dairy food,
yes,
it has to be at a minimal state. Yes. So another thing is meat. You limit your intake of red meat. Yes. You limit your intake of red meat. Yes. Another thing is that you participate in exercise very well. Exercise. And you are going to have good diet. And when we're talking about good diet, you have to include Fruit.
Fruits, vegetables.
Yes. Vegetables. Yes. Then nuts.
Wow.
Like cashew that contains zinc is very good.
Okay.
It's very good. Then fruits like citrus,
Mm.
all these oranges is
Mm.
very good.
Mm.
It's very good. So these are some of the lifestyle you have the grace to live up to 120. If we actually know and how to control our mouth. Most of all these things that is sweet in our mouth, they are not friendly to our organs. Most of the things that are bitter in our mouth are the ones that are friendly to our organs.
No wonder some of our old men, women, all these our agents, they are living longer than
Yeah, they live longer. All this process, all these kind of things we are eating now are not available those times. And they live longer and live longer. But the bottom line is that if you can control your mouth, then you can live long. But if your mouth is anything goes, the person will be down with one illness or the other, and if care is not taken, that may be what may cut short the person's life.
Wow. So I will go on with this again. It says if you can control your mouth, then there is absolute a chance for you to live longer. Are these treatment options?
Very good. Treatment option that is available for BPH is we have medications.
Okay.
Yes, in surgery. But all surgery is 50-50. It's 50-50. So surgery is there, medication is there, then therapy, exercise.
Okay.
Yes. And there is something I ought to mention. We can call it treatment and we can call it preventive measure.
Okay.
Now, as a man, you are meant to ejaculate 21 times in a month.
Wow.
According to medical experts.
I like the sound of this.
Yeah. According to medical experts, you should ejaculate 21 times in a month.
Roughly every day a man should be ejaculating.
Yeah.
You got to use working days, for instance.
Yes, like working days. To prevent BPH, benign prostatic hyperplasia. Yeah. So when you meet regularly, that is why men that their wife is dead or they are divorcee, that they don't meet regularly again, they tend to have prostate enlargement very fast.
Because there is no release.
There is no release.
Yes,
there is no release. So they tend to have it very fast. That is why we actually encourage, if your wife is dead, go and marry. If you are a divorcee and your wife is gone, yes, go and marry another. Because when you are no longer meeting regularly, there is 90 to 80% possibility that your prostate will begin to enlarge.
But is there a particular age range that a man has to stop meeting with a woman? Because now this is a preventive measure, and we know it is the risk factor start from age 40. Is there a specific age that you know that, according to which is there a specific age range that you believe that a man has to stop meeting with a man?
Thank you very much. There is no age limit.
Even a 100-year-old man
yes,
can still meet with
even 120
can still meet with a woman.
Even when the man wants to die tomorrow. Wow. Yes. Man, at the age of 40, you should be married under normal circumstances.
Wow. Okay, sir. So we are shaking the table right now. Wow. All right. So this takes me to my next question. I know you have stylishly talked about it while we are talking about the preventive measures of BPH. I'd like to ask you: are there lifestyle changes or diets that can help us to help people to manage or reduce the symptoms of BPH from happening? Or are there any lifestyle changes or diet? You talked about them briefly, but I want you to go in depth into it right now.
All right. Lifestyle changes that can actually prevent BPH. Number one, let the person engage in more exercise. More exercise. The person exercise very well.
There are some people who say, okay, I don't have money to go to the gym. Help us with some practical tips that they can use.
The person can even be jogging, and the person can be trekking.
Okay.
Can be trekking. As we all know, according to medical, yes, the aging starts from the leg. Immediately your leg start aging, you don't exercise your leg again. That is why I pity those people that every time they enter from car to office, they don't trek at all. Immediately your leg is becoming weak, exercise. Then number two, the person should stay away from anything alcohol.
There's something they can't do without it. It's even like hereditary. So what to do?
You see, when you know that this thing can kill you, and they have been telling you that this thing can kill you,
it's what is sweet that can kill this.
One day, when that death show you shadow,
the person will change.
The person will change. Yes.
For those of us watching us right now, and you are listening to us, this is the perfect time for you to change. A perfect time. Thank you, sir. More tips, sir. More practical tips.
Okay, yes. The diet. There should be fruit in the diet. Like I mentioned, citrus fruit,
citrus
oranges, grape, and the rest. Then vegetables.
Okay.
Vegetables. So all manner of vegetables and the rest should be part of the meal. Should be part of the meal. Okay. You know, there are some people they like only egusi, ogbono, and the rest. So immediately you are above 40, stay more with vegetable. The veg. It's it's more, it helps. It helps. Okay. It helps. Now, immediately you are about 40, your intake of all these egusis and the rest should be minimized. Should be minimized. Okra is vegetable. Ewedu is vegetable. You can take okra, you can take vegetable.
All this afan soup, all these ogbono.
Yeah, afan soup, I think still contains some vegetable too. Yes. Oha soup contains vegetable. Yes. Then nuts. You need nuts.
Okay.
Walnut is very good.
Walnut that is very bitter after you take water.
I have said it before that during the course of this broadcast, that anything that is bitter in your mouth is actually very, very advantageous to your what?
Your body system.
To your organs. But the one you take, like ice cream, and it's very sweet in your mouth, or the what's it called? The sweet, the minerals you take, the more, but it's very sweet in your mouth, you are indirectly damaging some of the internal organs. Yes. So the nut is very good. Then we have talked about regular exercise. So these are some of the diet. Yeah, these are some of the
things that can be lifestyle that can be designed to have a better
and we have said before, the person should actually have sex regularly.
Yes, another point. All right, thank you so much. I believe we are all learning one or two in today's topic. Today's topic is very, very germane, and it has really, really edified us for as many who are actually listening and jotting one or two things down. Please, before I move to my next topic, I believe in the comment section you should be dropping your questions right now. Do not wait until the end of the broadcast. Drop your questions right now so that Mr. ISREAL Odemuyiwa can provide answers and solutions to all your questions and concerns. So this takes me to my next topic, which is my last question. As a renowned KEDI consultant with many years of TCM experience, which KEDI product do you recommend for someone who is living with BPH? Which KEDI product do you recommend to them, and how what is the success rate? How effective as KEDI product that you have been recommending to some of the patients and some people that has contacted you? How effective has it been?
Oh, thank you very much. Over the years, we have used KEDI product to treat so many people that have BPH, and notable among them is one deacon from Ikoton that was supposed to go for operation for surgery, and he came and used our product, and the prostate that was already enlarged actually went back to the normal size. The urine started coming out, and the person never go for the operation again, and the person perfectly is okay since that time. Wow. So the surgery cancelled. Now, KEDI product is very, very effective. Very, very effective in swelling already. They'll be dealing with the swelling already. That is colon T and gastric force. Okay. Then another product we're going to recommend is reishi.
Immediately after these two?
Yeah, the person can use the two first, and after using the two, can go for reishi. Reishi, reishi is good for inflammation, and it's another antivirus product, antibacterial, antivirus, and antifungal product. So reishi will deal with any form of infection around that place that may be contributing to that enlargement. Yes. Another product that will be recommended that is very, very good for eating more of tomatoes. It's part of the vegetable the person will be taking, tomatoes. So inside our lycophyte, we have lycopene, that is one of the ingredients, the major ingredient inside tomato. So it helps for anybody that have come down with prostate issues. It helps very well. So another product is golden ivor. We recommend golden ivor as well. Golden ivor actually deal with anything inflammation. The prostate gland has been inflamed, and something has to what?
To take it down.
Take it down. Yeah. All right.
How do I use it?
All right. The column T is taken in the night. If the person is of my size, one sachet is okay, lasting in the night.
Of column T.
Of column T. But if the person is weighing something like 100 or 110 or 120, definitely the person has to be using 2 sachets in the night. Then the second one is the gastric force. Very good. The gastric force will be 3-3.
Okay.
3 morning, 3 nights. And let the person take it 30 minutes before food.
Both in the morning
or afternoon, after meal. Just 1 capsule in a day. So that is just the recommended dosage.
All right. So now we'll take a pause and we'll take questions in the comment section. First of all, we have a question from Mrs. Omotayo Adeonipekun on our Instagram handle. The question goes as I said, can benign prostatic hyperplasia lead to prostate cancer? We will talk about exercise when you're giving us earlier practical tips. Can we regard BC